Hello, everyone. Welcome back to another episode. In this episode, we will talk about why medication are so expensive in USA. This discuss going to be very important for you. So, sit back, relax, and enjoy the video. Prescription medications are a crucial part of healthcare, helping individuals manage chronic illnesses, recover from acute conditions, and maintain a better quality of life. However, the cost of medications in the United States has become a significant burden for many patients. Despite advancements in technology and medicine, the prices of prescription drugs in the U.S. continue to rise. So why exactly are medications so expensive in the U.S. compared to other countries? Here are 3 key reasons. 1. Lack of price regulation. Unlike most developed countries, the United States does not directly regulate drug prices. In countries like Canada and the UK, government agencies negotiate or set price limits for medications, ensuring they remain affordable for the public. In the US, however, pharmaceutical companies have more control over pricing, allowing them to set prices based on what the market will bear rather than what's affordable for consumers. This means that high demand for certain medications can lead to exceptionally high prices, often without a ceiling. While this free market approach encourages competition and innovation, it also creates room for price hikes. Pharmaceutical companies justify these increases as necessary to cover research and development, R&D expenses. But this lack of regulation can result in unaffordable medications for the average patient. 2. Research and development, R&D. Costs. The process of developing a new drug is time-consuming and expensive. Pharmaceutical companies spend billions on research and development, often working for years to develop, test, and bring a new medication to market. Only a fraction of the drugs in development actually make it to the approval stage, which means companies must recoup costs not only for successful drugs, but also for those that failed. This high-risk environment is unique to the pharmaceutical industry and contributes significantly to the price of medications. Additionally, the cost of clinical trials, regulatory approvals, and post-market safety monitoring all add to the price. Pharmaceutical companies argue that these high costs justify the prices of their drugs, as this revenue is essential for funding future innovations and continuing research into life-saving treatments. 3. Patent protection and limited competition. When a new drug is developed, it is typically protected by a patent for up to 20 years. During this period, the pharmaceutical company that developed the drug has exclusive rights to sell it, creating a monopoly. Without competition from generic alternatives, the company can set and maintain high prices for the medication. Once the patent expires, generic manufacturers can begin producing lower-cost alternatives, driving down the price. However, some companies use strategies like evergreening, making slight modifications to extend a patent, to delay generic competition and keep prices high. Limited competition is particularly evident with specialty drugs used to treat rare or complex conditions. These drugs often lack generic alternatives even after the original patent expires, enabling pharmaceutical companies to maintain high prices for a longer time. The combination of patents and limited market competition creates an environment where prices can remain inflated, affecting affordability for millions of Americans. In conclusion, the high cost of medications in the United States is a complex issue influenced by factors such as lack of price regulation, costly R&D processes, and patent protection. While these factors contribute to pharmaceutical innovation, they also place a substantial financial strain on patients. Addressing the high cost of medications will likely require regulatory reforms and new policies to balance affordability with the need for continued medical advancements. Until then, Americans will continue to face one of the highest medication costs globally.